Hi everybody, this is Dr. Mike. Thank you for tuning in. I am a chiropractor here in Williamsburg, Brooklyn, and this is my YouTube channel. I really want to thank you for tuning in. Thanks for watching, and please follow me on Twitter at Dr. Mike Fenster, also on Instagram at Fenster Chiropractic, the YouTube channel here, fensterchiropractic@gmail.com. There's also the website, inspinewetrust.blogspot.com. That's my blog. And yeah, look for big news coming soon. We have a big new website coming out, and really exciting stuff happening here for the chiropractic profession here in Brooklyn. So let's talk a little bit about sacrum today. And sacrum is a bone at the bottom of the spine. So if we have the spine here, that's the top, that's the skull and atlas and axis there on the top, like we talked about in those previous videos. But we're going to go all the way to the bottom, and this is the pelvis. Those two big bones around there are the pelvis, and that bone there in the middle with the little tailbone sticking out, which is coccyx, that middle part there is sacrum. Now, sacrum is very important for many different reasons. Sacrum has nerve roots that pass through it, and those are the nerve roots that go to all of the pelvic musculature, as well as the organs of reproduction and the urinary system, as well as defecation and all that stuff that happens down there in the bottom. But also, we're talking about biomechanically when the pelvis is moving around the sacrum. So when we walk, we take steps, and we have those two bones, those pelvic bones, that move around the sacrum. Now the sacrum acts as the middle point there, and the other bones are moving around it. But if the sacrum is locked in any position, we're going to have biomechanical pelvic dysfunction. How does that relate to chiropractic? Well, specifically in pregnant women, it relates to the possibility of a presentation of breached fetus before birth, which means that the infant is in the unideal position in the womb. Now, there's a lot of different schools of thought as to why that happens, but Dr. Larry Webster, a chiropractor, came up with his Webster's technique, which was actually a sacral adjustment to relieve pressure off of the infant in the womb, as well as a ligament contact on the front of the belly. Now, the sacrum plays a big role in that because when it's biomechanically out of place, it puts unequal pressure on the birth there. So it's very important if you're pregnant to be getting checked chiropractically, specifically with Webster technique, to make sure that everything is in place back there so you can have a beautiful, healthy birth. You can find out more information about Larry Webster and the Webster technique at ICPA for Kids. And I'll put the logo up, and icpaforkids.org, and that's number 4, icpaforkids.org. There's some great stuff on there. Dr. Jeannie Ohm has been a huge proponent of chiropractic care, prenatal chiropractic care, infant chiropractic care, pregnant mothers, everybody. So this is Dr. Mike tuning out from my YouTube channel here today. Thank you so much for tuning in, and have a great one. In Spine We Trust. Thank you.